time is 7:18 and the doctor is in. October is Breast Cancer Awareness Month, and this disease has claimed the lives of so many people that many of us know and love over the years. Most recently, actress Suzanne Somers. So joining us live here, Dr. Abby with Sharp Reese Steely. Dr. Abby, it's great to see you.
It's good to see you, Netta.
I know it comes up again, obviously. It's something that I think so many people have been touched by. But when you hear about Suzanne Somers having gone through it for what, 20 years, more than 20 years?
Absolutely. So it's rare for breast cancer to recur, and in some cases after it gets treated it can recur, unfortunately, but that's rare. But it's important to catch it early, so we know that early detection saves lives, so we definitely want to focus on that.
Okay. I know with early detection, obviously mammograms are huge. How important is it to do one regardless of your family history?
Absolutely. So it is a very, very common misconception that you don't have to do one if you don't have a family history. I've heard that a lot from a lot of patients, but it's important to get your mammogram screening. Starting at the age of 40, you have the option of screening every year or every 2 years. So talk to your doctor about that, and that is if you are average risk. So you don't have a family history, you don't have any other risk factors, then you should be getting your mammograms every 1 to 2 years.
So getting the mammograms at age 40, just schedule it with your birthday. And if you just schedule it, I think that's the best way to remember to get it done, so that, you know, that's a birthday gift to you, right? To have the gift of saving your life and preventing this.
Absolutely.
That's detecting it.
Absolutely. That's a really good idea, Netta, to schedule it around your birthday. It's just an easy thing to remember. And you're in and out. It doesn't take very long, so it's important to get it done.
Okay. Let's talk about some of the questions people may have had over years. I know I've wondered this too. Can deodorant cause breast cancer? It's something we hear among friends, and I don't know, people have described the lymph nodes in your underarm area. Also, tell me what you've learned about this, and have people ask this as well?
Absolutely,
Okay,
absolutely. So no, it's not just you. So it's okay to use your deodorant because there is no scientific evidence that deodorant causes breast cancers.
Okay.
But that is a common myth, and it actually came about because of a misconception about sweat glands and all of that. But you can use your deodorant. There's no risk with breast cancer.
So no matter what's in the deodorant, you don't have to find certain types with certain ingredients.
Well, that's a good question. Some people may have sensitivities, and I've actually seen a lot of people get rashes with certain deodorants, but in terms of it leading to breast cancer, no.
Okay, good to know.
No evidence.
This is another question that I think a lot of ladies wonder. What about your bra? Could that lead to breast cancer if it's too tight, or, I don't know, it sits in a different spot? Does that have any relevance?
No.
Okay.
So again, same thing, no evidence, and that is where the possible compression of lymph nodes misconception came about from, but there's no evidence of that. You can wear a bra, you can wear a bra with underwire. That's another common question that we get, but there's no evidence there either.
Okay, so the bra cannot directly cause this by pushing on lymph nodes. That is something that has been swirling around. So now we hear from Dr. Abby.
Yes,
as far as obviously any causes, you know, the way we treat our bodies. For example, drinking alcohol. Could that lead to cancer?
Yes, so it's important to focus on the actual risk factors and the risk factors that you can actually modify and you can improve. So drinking alcohol actually can predispose to breast cancer. Even drinking as few as 1 drink a day actually significantly increases risk, and also not being physically active, that can increase risk. If you're not at your ideal body weight from a medical standpoint, that can also increase risk. And of course, the things we can't change, which is we all get older, we all age, so you can't change that, so make sure that you are getting your screening on time. Okay,
so treat your body well.
Yes.
Being healthy, that weight, obviously, if you add a few extra pounds and you're in these dangerous levels, that increases your breast cancer risk.
It can.
Okay.
It can, yes, because if you have more estrogen from having more fat composition in your body, then that can increase breast cancer risk. So it's important to work on that, as we all need to do, but in a positive way. We also want to promote body positivity, and we don't want to look at this as, oh, this is your fault, you caused this. We don't say that, we don't do that. It's all about just being healthy.
Okay, and for men too, I know you mentioned estrogen. Women tend to think, oh, breast cancer is a female thing, or all people might think that, but men can get it.
Absolutely, anyone with breast tissue can get breast cancer, and that includes men. And it's, of course, a lot more rare, but it's important. So they should also be looking out for lumps and skin changes and all the things that you can see that may be associated with breast cancer, but it certainly is possible too.
All right, Dr. Abby, it's always great to hear from you. Get checked. That is the key message here. Of course, do your your own self-testing,
Yes.
mammogram, schedule that
Yes.
if you haven't done it. Thank you for your
Absolutely.
insight. Great to hear from you.
It's
And
good
don't
to
worry,
see you.
wear deodorant.
Yes, yes, you can.
Yeah,
That's
all right.
okay. It's good to see you,
know.
Netta.
We'll be right back after this quick break.